we're here to reflect on an innovative session today that looked at the patient's view in the periodontal care journey. So I'm going to speak to both of you, maybe, or allow both of you to come in on any answer your question, but you noted at the start of the session that patients see things differently or see different things from professionals. So how do we make sure to listen and to hear the patient's voice in periodontology? And could patient involvement lead to a change in policy if we do so?
So Peter, it's a great question. First of all, we need to have a mindset that there's a need to listen and not just talk. I think as dentists and periodontists, sometimes we're very keen to lecture patients about their condition and about what they should do. So we need to realize we need to step back and listen. We need to create an environment where patients are happy to open up and talk about their condition. Classically open-ended questions and statements. And we just need to then have a mind frame to sit back and stop talking. And listen.
I would agree with that, and I really pick up on the point that Ian's mentioned about interacting with the patient and getting the patient to understand that their view is important. I think from a patient's perspective, sometimes we're a little bit overawed by the dental professional, and we maybe are thinking, well, what do I know? He's the specialist. But in the same breath, he's thinking, well, I wish this person would tell me a bit more, because otherwise I won't know, everything that's going on and how they're feeling.
Okay. And we saw some patient stories today in videos that I think probably everyone should watch. It certainly makes you think differently, but they showed the impact of maybe stigma at one end about disease, and at the other end maybe an awareness that gum disease is important, and maybe making sure a patient can understand that when they first see signs, and that may impact on their journeys. So I suppose simply, how do we communicate better with our patients?
I think all communication starts with being open and honest, but you need to understand, I think it's important for the professionals to understand how impactful psychologically periodontitis can be. I mean, for my own part, there's the feeling of guilt that my lack of action or lack of cleaning and looking after my oral health properly has led to me having a very serious condition. But then you've got the actual outcome of the condition itself, potential tooth loss, bleeding gums, gum recession, and in my case, large gaps between my teeth post-surgery.
Okay.
So Neil, you talked about it in the film, and Peter, I completely agree with you. Everyone should watch the films, and the films will be available on the EFP website and YouTube very soon, to understand this aspect of stigma and shame. So the first thing again is recognizing that many of the patients who come to see us with periodontitis will be feeling that. We should open up and have some discussions. For instance, a simple way of doing it might be to say, some of my patients have told me that's how they feel. And that kind of statement isn't asking, it's just opening up. And we're also not making a judgment. So we're not judging that person saying, Neil, you're like this because you just don't clean your teeth. Yeah. Instead, we can be a supporter and a coach. And we also need to have some positive messages. You bring that up as well, and it came out in the session frequently, and in our working group sessions a lot, how motivational it was to get positive feedback from the dentist and from the hygienist. Again, as a dentist, as a periodontist, it's very easy for me to say, Neil, you have 5% of your pockets that are still bleeding. I could say 95% of them are not bleeding. Yeah. But I can choose how I communicate that message. Messaging is very important.
Okay, so that probably leads into my next question is, does messaging matter from a clinician's perspective, talking to their patient, and maybe at a more public level for advertisers? Does messaging matter?
Absolutely, and it's getting the messages out there to a wide enough audience to have an impact. But as Ian was alluding to, although this is a serious condition, the treatment can be quite severe. and if not treated, the outcomes can be very severe. But there's a good news story in that it is treatable, and it's nothing extreme in terms of space age technology or anything like that. It's fairly straightforward, and at the end of it, the likelihood of a good outcome is very high.
Okay. All right. So I suppose maybe to close, I might ask you, as a profession, we pride ourselves on being science-led and evidence-based in our approach to treatments. So there's a natural concern that with the increasing availability of information, or poor information or misinformation, that patients may make poor decisions about their own care or care journey. How do you think that feeds into what we need to think about next?
So one of the ways that I believe is important is, you're completely correct, Peter. We need good science, we need good evidence, but on its own, that's not enough, and on its own, that should never drive or dictate healthcare. So we talk more about evidence-informed healthcare, where we know we have good evidence, we know that evidence ourselves as clinicians, but we also spend time talking to Neil. We try and explain, we need to understand you, Neil, to understand what do you feel your problems are, what for you, what are you looking to achieve, and then we can start to bring together Neil's concerns and what's really bothering him with what the options and the evidence can provide him. And we can then discuss those options, what they can offer, the positives of those options and the downside of those options. But it does take communication, it takes a lot of understanding, it takes a lot of developing a relationship with your patient.
Indeed. I mean, just to summarise that, patients are your best feedback loop.
Yeah.
We're there, we have voices.
Okay. And thank you both. It was a really fascinating session. Thank you.
Thank you.
Thank you, Peter.